Welcome back. Dr. Snider from Cone Health is joining us for one more segment today. She is talking about all things COVID, vaccines, boosters, and the like. Dr. Snider, somebody texted us wondering, are you still most contagious right after you test positive, or has that changed with the new variant?
Right now, our belief is still that you are still have the highest infectivity at the time of the onset of your symptoms, even up to like 5 days after. So if anybody can still do isolation, staying at home for 10 days, that's optimal. I think a lot of us still need to get to work, and if your workplace allows you to get back after 5 days of isolation, it's really still important to wearing a well-fitting mask, preferably like a KN95 or N95, when you get back to the workplace through the end of that 10 days. This is a very contagious virus. So, right now we're seeing not just the one person in the household, we're seeing almost everybody who gets it unless you're able to separate or wear a mask.
Somebody's wondering, if I've had both boosters, can I still get the newer vaccine in the fall?
You can. Also, right now, anybody who's qualified to get a vaccine, you have the option to also switch onto a different mRNA vaccine series if you'd like.
Someone texted us saying, does your risk for long COVID get worse each time you get infected?
That is a great question. I don't think we know quite yet, but I believe that right now the thought is that by being vaccinated, you do decrease the risk of getting what's considered the long COVID.
What are your thoughts on the newest vaccine I think it's still in the process of getting approval? Is it AstraZeneca?
I think it might be Novavax.
Or Novavax, I don't know what, okay, Novavax.
Yeah, I think that's another great option. It's a different delivery model. It's also, it makes sense that if people have been hesitant for the mRNA vaccine to switch over to getting that vaccine series.
Any idea when that one might come out? Because it's still not approved yet, correct?
I believe it's still trying to finish up one more approval process, but it's getting close.
Someone is wondering about one of the old versions of the vaccine. They say, should people stay away from the Johnson & Johnson vaccine?
Correct. I think a lot of people in the beginning were really excited about the J&J vaccine because it was a single dose. Since then, we have noticed the uptake of the platelet clotting issue causing strokes, and also that its vaccine efficacy is much, much less. So the recommendation is that if somebody's had that one dose, we are recommending to switch over to the mRNA series.
We have just about 30 seconds left, but what would you say is the biggest misconception you have heard from people just regarding the pandemic as a whole lately?
Yeah, I think people are pretty tired, right? They're tired of wearing masks. They're tired of being asked if they've been vaccinated, but it's still very important. We know that the vaccines work. They do prevent significant severe disease and prevent hospitalizations and deaths. There's been a pretty amazing paper that mentioned how many lives have been saved because of the vaccine. So this is the right time. We need the people who are up for in that time frame to get boosted, to get some. Please encourage getting your children boosted and vaccinated. And right now, it's really important, if you're going to be in an enclosed space, to be wearing masks.
All right, Dr. Snider, thanks so much for your help and your expertise as always. You can re-watch this entire 30 minutes on our YouTube page after it's posted.